All right, let's dive in. Today we're exploring something that plagues millions, IBS, or irritable bowel syndrome.
Yeah.
That mysterious gut gremlin.
Uh-huh.
We're dissecting a transcript from, well, a healthcare professional who, let's just say, has some thoughts on how IBS is diagnosed.
They do. They're making a pretty strong case that
Yeah.
IBS is kind of a catch-all diagnosis. Like when doctors can't quite figure out what's really going on with your gut, they just slap on the IBS label and call it a day.
Oh, so like a placeholder diagnosis almost.
Exactly. It's like,
Just a way to categorize it without actually figuring out.
yeah, kind of a we don't know, so let's call it this. But here's the thing. They even suggest the label itself can be, well, kind of harmful in a way.
Harmful, how so? Because if you're, dealing with all those awful symptoms, wouldn't just having any diagnosis be better than none?
Not necessarily. It's like, imagine you go to the doctor with a fever, they say, yep, you've got a fever, and send you on your way.
Right, but the fever's just a symptom, not the actual root problem.
Exactly. You wouldn't stop at just knowing you have a fever. You'd want to know why you have it, right? Is it a cold? Is it the flu? Is it something more serious?
Of course, because knowing the cause helps you know how to treat it properly.
Right. And this expert's argument is that the same logic should apply to IBS. They actually compare it to fibromyalgia.
Interesting. I can kind of see that connection because like with fibromyalgia, you have the widespread pain, but it's more like a description of what's happening rather than telling you why it's happening.
Precisely. And with IBS, if you're just focused on managing the symptoms, you might be missing the real culprit behind those gut woes. And that culprit could be something completely treatable.
So it's almost like a disservice to just settle for an IBS diagnosis without really digging deeper.
That's their point, exactly. And they go on to lay out a whole bunch of conditions that can often be mistaken for IBS.
Okay, so what are we talking about here? What are some of those IBS imposters, as you call them?
Well, one of the big ones is celiac disease, that autoimmune reaction to gluten. And get this, studies show something like 80 to 85% of people with celiac disease are completely undiagnosed.
85%. Wow, that's a staggering number. But why are so many cases being missed? If it's that prevalent, you'd think.
Well, this expert suggests that relying solely on antibody tests might be part of the problem.
So the tests aren't always accurate.
Not always, no. And apparently, not everyone with celiac will even have a positive antibody test.
Oh, wow. So it can be pretty tricky to diagnose.
It can, and the implications of missing a celiac diagnosis are huge.
Yep.
I mean, we're talking long-term health problems like malnutrition, bone loss, and even some types of cancer if it's left untreated.
Yikes. Makes you think twice about just brushing off digestive issues. Okay, so we've got celiac. What else is on this list of potential IBS mimics?
Well, they also talk about SIBO,
SIBO, remind me.
small intestinal bacterial overgrowth.
Right. I've heard of that, but refresh my memory. What exactly is SIBO?
Okay, so picture your small intestine like a carefully balanced ecosystem, right? When you have SIBO, it basically means there's an overgrowth of bacteria in that space. It throws everything off balance.
Okay, and how does that tie back into IBS?
Well, that imbalance, the overgrowth, leads to, you guessed it, bloating, gas, diarrhea, abdominal pain, all those classic IBS symptoms.
Oh, I see. So the symptoms basically overlap, making it hard to tell the difference without more specific testing.
Yeah, it's a tricky one. But the good news is there are tests for SIBO, and it's definitely treatable once you know you have it.
Okay, so celiac, SIBO. Anything else we should be wary of?
They also mentioned hypochlorhydria.
What now?
Hypochlorhydria is a fancy way of saying low stomach acid.
Oh, low stomach acid. Now that seems counterintuitive, doesn't it? I mean, wouldn't low stomach acid be a good thing? Less heartburn, right?
Not necessarily. You see, stomach acid is actually pretty important. It helps break down food, kills off harmful bacteria, and all sorts of important stuff. So when you don't have enough of it, well, it can trigger a whole cascade of problems.
Like what kind of problems are we talking about?
Well, for starters, you might get indigestion, that feeling of fullness after you eat, or what they call dyspepsia.
Uh-huh.
But here's the kicker. Low stomach acid can actually contribute to that SIBO we were just talking about.
Oh, really? I didn't realize those two are connected.
Yeah, if your food isn't properly broken down in the stomach, it can create the perfect breeding ground for bacteria in the small intestine, which, remember, is what leads to SIBO.
Wow, it all comes full circle.
Yeah.
So what causes low stomach acid in the first place?
Well, this expert mentioned a few things. Overuse of those proton pump inhibitors, the PPIs, the ones they give you for heartburn. And surprise, surprise, chronic stress can play a role too.
Stress again. Man, stress really is the root of all evil, isn't it? Or at least a lot of health problems. But okay, speaking of things that make you go, ew, parasites. I mean, they brought up parasites, right? I'm kind of afraid to ask.
Yeah, the parasite talk. It might sound far-fetched, but, parasites like Giardia and Cryptosporidium are, well, more common than you might think. And guess what? They can mimic those IBS symptoms too.
Seriously. So you're
Yeah.
telling me I could pick up a parasite from like a salad bar? I mean, come on, that's a little.
I'm not saying it's likely, but unfortunately, it's not
Mm.
impossible. These little critters can lurk in seemingly clean places, even on produce that looks perfectly fine. And to illustrate just how tricky diagnosing parasites can be, they actually share this anecdote about a patient who picked up Giardia while on vacation.
Oh no.
It took 7 years for them to get the right diagnosis.
7 years? That's insane. It makes you wonder how many people are walking around with undiagnosed parasites and just think they have IBS.
Yeah, it really highlights the importance of advocating for yourself and pushing for thorough testing if you're dealing with persistent gut problems. Don't just settle for the easy answer.
Absolutely. 7 years is a long time to suffer unnecessarily. Okay, so we've got gluten issues, bacterial overgrowth, low stomach acid, parasites. Is there anything else this expert thinks might be lurking behind that IBS label?
Well, they also talk about something called pancreatic insufficiency.
Pancreatic insufficiency. Isn't the pancreas like the insulin and blood sugar organ? What's that got to do with digestion?
Well, yeah, that's part of its job, but it also plays a major role in digestion. It produces enzymes that help break down food in the small intestine. And they were specifically talking about exocrine pancreatic insufficiency, which is the type that affects those digestive enzymes.
So if your pancreas isn't working properly, it can cause problems similar to IBS.
Exactly. You can experience bloating, gas, diarrhea, abdominal pain,
Hmm.
the usual suspects.
Wow, it's amazing how many different things can mimic IBS. I feel like I'm learning so much. So far, we've covered gluten, bacteria, stomach acid, parasites, pancreatic insufficiency. Is there anything else we should be aware of?
Well, they briefly mention a couple of other things like endometriosis and thyroid issues that can sometimes be mistaken for IBS, but those were just kind of touched on in passing.
Okay, so it sounds like IBS is less of a diagnosis and more of a starting point for a much deeper investigation, like a red flag that maybe something else is going on.
That's a great way to put it. And that's really this expert's main message. Look beyond the IBS label, consider all the possibilities, and get to the root of the problem.
And a big part of that seems to be advocating for ourselves and making sure we're getting the right tests.
Absolutely. The expert actually expresses some frustration with how short doctor's appointments are these days and how patients really need to be proactive about their own health. You can't just passively accept an IBS diagnosis without exploring other options.
Okay, so we've talked about all these potential IBS imposters, but what about stress? We can't forget about that whole mind-body connection, right?
You're right, stress definitely plays a role in all of this, but it's not as simple as saying stress causes IBS.
Right. So how does this expert view the role of stress in all this? Is it a major player or just a bit part?
Well, they acknowledge that stress can be a significant factor, but they encourage us to think about whether it's the primary cause of our digestive issues or if it's more like a contributing factor alongside other problems.
Okay, so it's not just about eliminating stress entirely, which, let's be honest, is probably impossible for most of us. It's about figuring out how much of a role it's playing and addressing those underlying issues as well.
Exactly. And to help figure that out, they actually mentioned this thing called the vacation test.
The vacation test. That sounds intriguing. Tell me more.
Well, have you ever noticed how your gut issues magically seem to disappear when you're on vacation?
Oh, 100%. I mean, when I'm on vacation, my biggest digestive dilemma is deciding which cocktail to order next. But back in the real world, it's a whole different story.
Right. That's the idea behind the vacation test. If your symptoms vanish when you're relaxed and stress-free, it might suggest that stress is a major driver of your digestive woes.
Interesting. So it's not a foolproof diagnostic tool, but it can be a helpful indicator.
Exactly. And it really highlights that connection between our mental state and our gut health. It's not that stress causes IBS, but it can definitely make things worse.
Okay, so it's about managing stress effectively and addressing those underlying issues.
Right. And that's where this whole idea of careful investigation comes back into play.
Hmm.
You need to identify those culprits, whether it's celiac disease, SIBO, hypochlorhydria, or something else entirely, so you can develop a targeted treatment plan.
It makes me think about this expert's final message in the video. They talk about hoping everyone can eat everything, go to the bathroom perfectly every day. It's so simple, yet for a lot of people it feels completely unattainable. What does that even look like?
Yeah, it's a powerful image, isn't it? It speaks to the idea that digestive health is about more than just not being sick. It's about freedom. It's about enjoying food and feeling good.
I love that. I mean, so much of our lives revolves around food, social events, cultural traditions, even just, fueling our bodies to get through the day. And it's easy to take it for granted until something goes wrong.
Absolutely. This whole deep dive has really underscored how interconnected our physical and mental health are, especially when it comes to our gut.
And it's made me realize that we shouldn't just accept a life of digestive distress, not when there might be a treatable cause hiding in plain sight.
That's a powerful takeaway, for sure. Don't just accept a label. Ask questions, advocate for yourself, and demand a thorough investigation. Your gut will thank you for it.
I think that's a perfect note to end on for part one of this deep dive.
Yeah, it's about being able to, eat without worry and actually enjoy the experience.
Absolutely. And speaking of taking charge, thinking back to all those conditions that can mimic IBS, what are some things people can do to, really advocate for themselves when they go see their doctor?
That's such a crucial point, and I think preparation is key. Like before you even step foot in that doctor's office, start keeping a symptom journal, like a
Yeah.
really detailed one. What are you eating? When are those symptoms hitting you? Any patterns you're noticing?
Oh, that's so smart. I'm terrible at remembering those things on the spot. Like when I'm actually in the doctor's office, I get flustered and forget half the things I wanted to say.
It happens to the best of us. But having that journal can help you stay focused. And don't be afraid to, speak up, ask questions. If you're not satisfied with a simple IBS diagnosis, push for those specific tests we talked about, for celiac or SIBO or even parasites.
Right, right. So basically, be your own health advocate. Don't be shy about it.
Exactly. It's your body and you deserve answers.
I love that. Be your own health advocate. We should put that on a t-shirt. But okay, we've talked a lot about misdiagnosis and getting to the bottom of things, but what happens when someone, actually does have IBS? Is it just a life sentence of discomfort?
Not at all. Even though there's no cure for IBS, there are tons of ways to manage those pesky symptoms and, get your quality of life back.
Okay, that's good to hear. What are some of the most effective ways to manage it?
It usually involves a multi-pronged approach.
Mm.
Diet plays a huge role, and working with a registered dietitian can be a game changer. They can help you figure out which foods are triggering you and create a personalized eating plan that, keeps those symptoms at bay.
That makes sense. But there's so much conflicting information out there about what to eat, what not to eat for IBS. It can be so overwhelming.
Totally. It's a minefield of information, and that's why having that expert guidance is so valuable. A dietitian can cut through all the noise and help you figure out what works for you.
Okay, so diet is a big one. What else can people do to get those IBS symptoms under control?
Stress management is another key piece of the puzzle. Remember how we were talking about how stress can really exacerbate those IBS symptoms?
Yeah.
Well, incorporating things like yoga or meditation or even just deep breathing exercises, stuff like that can help regulate that gut-brain connection and bring those stress levels down.
So it's not just about what we're putting into our bodies, but also how we're managing our mental and emotional state. It's all connected.
Exactly. It's that mind-body connection we keep talking about. And there are other tools too, like gut-directed hypnotherapy. That's shown some really promising results in clinical trials.
Gut-directed hypnotherapy. That sounds pretty out there. How does that even work?
It's actually pretty fascinating.
Yeah.
It's a type of therapy that specifically targets the gut-brain connection. It helps people develop coping mechanisms for stress and pain, and it can actually retrain the brain to respond differently to those gut sensations.
Wow, so it's almost like a mind over matter approach to IBS.
In a way, yeah. It's
Yeah.
about harnessing the power of your mind to influence what's happening in your gut.
That's incredible. It seems like there's so much more to IBS than just, accepting a diagnosis and resigning yourself to a life of misery. There are options.
That's exactly the message I hope people take away from this whole deep dive. Whether you've been diagnosed with IBS or you're concerned about being misdiagnosed, there are steps you can take. There are things you could do to feel better. You don't have to suffer in silence.
I love that. And I think this expert has done a fantastic job of really giving people hope. They've highlighted the importance of thorough investigation, of stress management, of of exploring all the different treatment options out there.
They really have. They're challenging us to think beyond that IBS label and really focus on achieving, optimal gut health.
Which brings us back to that beautiful image they shared of everyone being able to eat everything, go to the bathroom perfectly every day.
Yeah, a world without gut problems.
What does that kind of digestive freedom look like for you?
Hmm, that's a good question. I think for me, it's about, being able to just enjoy food without fear, without anxiety,
Hmm.
feeling energized and vibrant and not being held back by those digestive discomforts. What about you? What does it look like for you?
I think for me, it's about being able to, just fully participate in life, to go to social events, to travel, to try new foods without having to worry about my gut acting up. It's about reclaiming that sense of spontaneity and joy.
I think that resonates with a lot of people. I mean, gut health is so fundamental to our overall well-being.
It really is. It affects our energy levels, our mood, our social lives. I mean, it's all connected.
This deep dive has given us so much to think about, hasn't it?
It really has. It's been a journey of discovery, uncovering the complexities of IBS and really emphasizing the importance of advocating for ourselves.
Yeah, it's made me realize just how much we tend to take our digestive system for granted
Yeah.
until it, starts acting up.
Oh, for sure. It's like when everything's running smoothly, we don't even think about it. But boy, when things go wrong, it takes center stage.
It really does.
Hmm.
But this deep dive, it's given us so much knowledge. Like we've got the tools now to really understand those IBS complexities and to recognize when maybe something else is going on, and most importantly, to advocate for ourselves.
Absolutely. Hopefully it sparks some curiosity in our listeners too, to really take a look at their own gut health journey.
I hope so. Well, for everyone listening out there, we've covered a lot of ground today.
We have.
From that fascinating gut-brain connection to all those conditions that can masquerade as IBS, like celiac and SIBO.
And we've talked about how crucial it is to really push for thorough testing and not just settle for a quick diagnosis.
And how important it is to manage stress and find those treatment approaches that really work for you.
Oh, absolutely. But as we wrap up this deep dive, I want to leave you with one final thought.
Okay, I'm listening.
Remember that expert's vision of everyone being able to eat anything they want and go to the bathroom perfectly every day.
Yeah, a world without digestive distress. Sounds pretty idyllic, doesn't it?
It does. It might seem like a far-off dream, but I think it starts with each of us, taking charge of our own health.
By being informed and asking questions and advocating for ourselves, we can definitely get closer to that vision.
So, dear listener, what does your ideal digestive health look like?
Yeah, take a moment to really picture it. Imagine a life where food brings you joy, where it nourishes you without causing you anxiety or discomfort.
That's beautiful. And if this deep dive has inspired you to take action, we'd love to hear from you.
Yeah, share your thoughts, your questions, your personal experiences on our website or social media.
You never know. Your story might just help someone else who's, struggling silently.
And remember, you're definitely not alone in this. We're all in this together.
Well said. Thanks for joining us on this deep dive into the fascinating world of IBS and beyond.
Yep. Until next time, stay curious, keep learning, and most importantly, take care of your gut. You only get one.